Let me ask you something. In exams, when examiner asks you, classify squint, do you feel or you just start classifying squint randomly? Most PGs lose their marks not because they don't know squint, but they don't know how to structure it. Right? Hello PGs, welcome to my channel of Hell Exams and Viva. And today I'm going to give you a flow chart so clear that you can remember classification squint for life. Let's start. Okay, so to classify squint, I'm going to give you a flow chart which no other co-PG of yours is going to make it in exam. You are aware of all these terms. You just have to learn how to structure it in exams to gain marks and save time. This is a very important question, classification of squint. It comes as a separate short note also. It comes as part of long answer question also. And sometimes examiners ask in Viva. Instead of answering randomly, I am going to give you a flow chart to remember it, right? Let's start. So we remember the classification of squint based on this mnemonic F, D, A, G. So I am going to divide classification of squints based on F is for fusion. D is direction of deviation. Is it right to left, up or down, or is it torsional? Age, this you are already aware if it is congenital or acquired or varying with gaze, right? So you remember fusion, direction, age, and variation with gaze. Now we further divide it into fusion. It is controlled by fusion, then it is a latent squint, and we call it phorias. So you divide into heterophoria and heterotropia. चार ही टाइप के स्क्विंट है जो आपने हर जगह लिखने हैं. Iso, iso means inward rotation of the eye. Exo is outward, out. It is out. Exophoria, esophoria, hyperphoria or cyclophoria. Tropia, when it is already manifested squint, it can be of two types, intermittent and constant. So this was based on fusion. Now we come to direction of deviation. So if we imagine this side, right? So deviation, suppose this is nose. Now if the deviation is horizontal, it could be inward, eso or outwards, exo, right? वर्टिकल में ऊपर जा सकता है और नीचे जा सकती है, ठीक है. सो यू रिमेंबर एज हाइपरट्रोपिया और हाइपोट्रोपिया. एंड देन टॉर्शनल, लाइक आईबॉल इज रोटेटेड इनवर्ड्स और रोटेटेड आउटवर्ड्स. सो यहाँ पे हम डिवाइड करते हैं इट एज इनसाइक्लोट्रोपिया और एक्ससाइक्लोट्रोपिया. तो जनरली टॉर्शनल कब आएगा? जब कोई ओब्लिक मसल खींचेगी. सो दिस इज जनरली ड्यू टू ओब्लिक पेल्सीज, राइट. एज में when congenital acquired, congenital में all infantile because generally बच्चों में ही देखेंगे हम. And acquired we can mention acute, sensory, paralytic, restrictive, all other types of squint. Now most important part is the variation with gaze. G, this is G. So F, D, A, G. Now what is very important for long answer question is this, gaze. Question is like classify squint and you describe this comitant or incomitant type of squint. And to classify squint based on variation of deviation with gaze position, you divide it into isodeviations or exodeviations, right? So this is like iso, अंदर की तरफ गई, convergent, so esotropias, and these are exodeviations. Exo is outside eye. So this is exodeviations. Now these two will be divided into concomitant and incomitant. Concomitant and incomitant दोनों को divide कर दीजिए ऐसे. Now we'll see what comes under what. Now this is very important to bring out in the exams and to clear your concepts also, that which type of squint is under which classification. So even if you don't know about any topic and it comes in your exam, suppose I take Brown syndrome, you don't know about what is Brown syndrome and you have never heard about it, but you know about this classification. So you can still talk about Brown syndrome under restrictive, incomitant, esodiviation, right? So you can write something about esodivation or concomitant squint for Brown syndrome. So this is very important to remember, and when you make this flowchart in exams, examiner is going to give you marks for sure, and you are going to save a lot of time to just make this flowchart and complete your answer. So let's discuss one by one. So we went into ESO and EXO deviations. Now ESO, you went into concomitant and concomitant squint. Now, concomitant, you went into accommodative, partial accommodative, and non-accommodative. In accommodative, accommodation क्या होगा? Reflection से ही आ रहा होगा, ठीक है? So we divide into refractive and non-refractive. We divide into refractive and non-refractive type. Partially accommodative and then non-accommodative concomitant squint, right? So this part is very important, and you have to remember all these 7 subparts of this classification, because every part is itself a separate question in Squint, right? So you remember essential, infantile or essential acquired. Now in essential acquired, it could be basic Squint, convergence excess, divergence insufficiency. Now let's see what is convergence excess. So basic means बस ये nose है, ये आई है, बेसिक इज, हाँ ठीक है, आई अंदर की तरफ चली गई, बेसिक, वी सेड इजोट्रोपिया। कन्वर्जेंस एक्सेस मतलब बहुत ज्यादा कन्वर्ज हो रही है, इसलिए अंदर की तरफ जा रही है, कन्वर्जेंस एक्सेस हो गया। डाइवर्जेंस इंसफिशिएंसी मतलब बाहर की तरफ नहीं जा पा रही है, इसलिए अंदर की तरफ पड़ी हुई है आग, राइट? So you remember as basic, convergence excess, divergence insufficiency, concomitant squint. Then it could be acute. Then there is something known as microtropia, and it can be cyclic esotropia, sensory esotropia, and there is a term known as nystagmus blockage syndrome. So we'll see this also in detail. Now in concomitant squint, it is even to paralytic, restrictive, and other special squint also. Special squint. So paralytic आपको पता है nerve ही paralyze होगी, तो third nerve, fourth nerve, sixth nerve paralysis हो जाएगा, and there is something known as internuclear ophthalmoplegia also. So this is mainly neurogenic, right? And second is myogenic. Paralytic में तो always remember M and N, या तो nerve जाएगी या muscle जाएगी, right? So paralytic, neurogenic, जिसमें आपकी nerve palsies आ जाएंगी, internuclear ophthalmoplegia. And if we talk about myogenic, we know there is myasthenia gravis and thyroid eye disease, squints, which are concomitant. Then there is a type of restrictive squint, Duane's retraction syndrome, Brown syndrome. Then we also learned about blowout fracture of orbit, right? हमने पढ़ा था ना उसमें that inferior rectus entrapment is there, and because of that restrictive squint is there, mainly the patient has vertical diplopia. You don't remember? Now go and listen to this video. Blowout fracture of orbit. I have beautifully explained each and every thing you need to know regarding blowout fracture. एक बार ये वीडियो सुन लोगे, your concepts are clear, you know what to write in exams, and you know all the Viva questions. Go and watch this video also, right? After this. And next special squint is AV phenomenon. We'll be discussing this also in a separate video, right? Now, this was zero deviations, which is now very important to write in exams like this, because it gives a very good impression. Then you depend into exo deviations, like again into comitant and incomitant. Comitant में exo में आप कैसे बताओगे? Divide into primary and secondary. Primary मतलब infantile हो गया और intermittent हो गया. Just I you remember I. Infantile, intermittent, primary concomitant exodeviation, and secondary में remember SS. Secondary में sensory हो सकता है और after surgery, which is known as consecutive deviation. Remember this. In concomitant, again we went into paralytic and restrictive or musculofacial abnormalities. So for paralytic, it could be at the nucleus level. So we can divide into supranuclear, nuclear, infranuclear. And in musculofacial abnormalities, in concomitant, you have 3 Ds. DRS, obviously, DRS is a type of restrictive incomitant squint with exodeviation, but part 2 and 3 can have exodeviations also. DHTs, these are dissociated horizontal deviations. We'll expand on it later. And distracted. So you remember as 3D, right? Simple. Now close your eyes for 5 seconds and now you can imagine this flowchart very nicely. Let's revise in 5 seconds. Iso, exo किया, concomitant, incomitant किया दोनों में. Then in concomitant, you divide it into accommodative, partial accommodative, non-accommodative. In incomitant, you went to paralytic, restrictive, and special squint, which is AV phenomenon, right? Then accommodative refraction related होगा, so we divide into refractive or non-refractive. Non-accommodative में you divide into essential, राइट, इन इन्फेंटाइल एंड एक्वायर्ड. एक्वायर्ड में मैंने बताया आपको बेसिक कन्वर्जेंस एक्सेस और डाइवर्जेंस इनसफिशिएंसी, तो अंदर की तरफ आई जाएगी इजोट्रोपिया होगा. देन अदर्स आर एक्यूट माइक्रोट्रोपिया, साइक्लिक सेंसरी एंड निस्टैग्मस ब्लॉकेज सिंड्रोम. रिमेंबर ऑल दिस, राइट. पैरालिटिक में नर्व न्यूरोजेनिक मायोजेनिक मेंशन कर दो. रिस्ट्रिक्टिव में ड्वान्स ब्राउन्स and blowout fracture of orbit, and speckle squint has AV phenomenon. एक्सोडेविएशन में कॉन्कोमिटेंट इनकॉमिटेंट, अगेन प्राइमरी में आप याद रखो आई आई, सेकेंडरी में याद रखो एस एस. इनकॉमिटेंट पैरालिटिक में न्यूक्लियर पैल्सिस और मस्कुलोफेशियल में डी डी डी. Now before I just finish it, I want to tell you certain points differentiating concomitant and incomitant, right? So concomitant squint is more common, right? It is mostly congenital. And there are two types of deviation, primary deviation and secondary deviation. So in concomitant, primary deviation is equal to secondary deviation, right? And there is no limit to extraocular muscle. कोई limit नहीं है, कहीं भी आँख जा सकती है. And that's how there is no head posture. So you remember these 4 points. We will be discussing in detail in upcoming videos, but because this part is just classifying swings, so I don't want to complicate it much here. Clear your thoughts by dividing it in this way, and this is going to help you a lot while writing your answer. And wow, beautifully, we have classified swings in a flowchart, right? So next time if examiner asks classify swing, you won't panic. We don't just study the topic, but we learn how to structure it in exams. So you have all the knowledge and just give you a clear framework how to remember it and how to write an exam. Perfectly often learning.